You're watching the Body, Mind, Spirit, and Motion, and I'm your host, Jill Hewlett. For any questions or comments, please visit my website at jillhewlett.com. We always enjoy hearing from you. On today's show, we have a well-known bodywork practitioner from our community, and we're going to be talking about, with Mark Levine, osteopathy and craniosacral therapy. Thanks for joining us, Mark.
Thanks for asking me to be on the show.
Oh, well, it's a pleasure. And this isn't your first time being on our program?
No, this is the second or third.
Second, maybe even third. Wow. Well, we keep having you back because the work you're doing is helping so many people, and you're quite an expert in the field of body care and wellness.
Yeah, thank you. Yeah. That's, I've been in practice 18 years, so now I have a sense that, you know, I have something to offer.
Yeah, you've graduated.
That's right.
Well, it's nice to see someone who is evolving through their life in the work they're doing and bringing that richness to it. And I hadn't had a personal session for some time, and I came back and just in preparation for the show had a few sessions, and not only do I know I needed it, how much I benefited. So what we're talking about on today's show isn't just for people dealing with injury or physical, emotional, mental problems. It's for anyone out there who wants to just take better care of themselves.
Wellness is certainly a big part of a lot of people's lives, and wanting to find out more, curiosity about novel body-mind experiences is a big part of what keeps us healthy, really.
Exactly. So, it's holistic, and that's what this show has always been about, is different ways to do that, different resources, and you're such a great resource. And I know you have an affinity for babies because you specialize in pediatrics.
Yeah. I mean, craniosacral therapy is really a subspecialty of body work and osteopathy, and pediatrics in that is, again, a subspecialty. So there are not many people who are working with infants and babies and children, but that's the bulk of my practice. About 70% of my practice is
And that's
pediatrics.
interesting. I mean, maybe viewers are finding that to be kind of astounding themselves, because we wouldn't naturally assume maybe that little babies would need care so early, and yet it's the opposite. They actually do.
Well, there's a saying, as the twig is bent, so grows the tree. So when babies are first coming into this world, it's a rough ride to get here. The birthing experience under the best of all possible circumstances is pretty difficult.
It's intense for mom too.
It's very intense. Yeah, I mean, with vaginal delivery, a baby would be born with a shaped head. You can imagine the pressures that actually create that. You know, typically babies come out with their heads looking like a cone for the first few hours or days, and over the course of a few days, it gradually fills back out again. So, in situations where there have been difficulties, situations where the birth wasn't progressing as it ought to, or there was use of interventions like forceps or vacuum extraction, or situations where they had to do an emergency cesarean section. These are situations where the baby doesn't go through the biologically programmed process that would make sense at a cellular level to the baby and to the mother.
Right.
So in situations like that, there's often behavioral issues like colic and rigidities, or physical, like neuromuscular issues that the babies have to overcome. So craniosacral therapy is a really wonderful way of addressing that.
Oh, absolutely, absolutely, and that it probably wouldn't take much.
No, it's really, I mean, that's one of the amazing things. Working with babies are so soft and plastic, and they unwind. They don't have what we have as adults, which is this. They don't have the baggage. They don't have, and as a result of the baggage, they don't have that neuromuscular armoring that we as adults do, and they don't have a kind of investment in their ego to say, well, you know, I'm not willing to unwind or move in ways that would allow for changes to happen in my body.
Because they haven't been conditioned to not.
That's right.
Right?
Not yet.
Yeah, right. So with the work you're doing, you're allowing them to come back into their natural state and balance.
That's right.
Early on, so they can grow efficiently and beautifully or effectively.
That's right. And to be specific about that, a big part of, I mean, to explain from the beginning, craniosacral therapy, as it says in the word, cranio refers to the cranium, which is the skull, the head, the whole head. Okay. And the sacrum, or sacral, refers to the sacrum, which is the tailbone, the triangular-shaped bone at the bottom of the spine.
So the lower back.
And in this model, which is where the blue is, refers to the soft tissues, the connective tissues that wrap the brain and spinal cord. So the craniosacral system really comprises the bones of the head, neck, face, all the bones of the spinal column and the sacrum, the tailbone, plus the connective tissues that are inside that bony system. And that is the wrapping around the brain and spinal cord, also known as the meninges or the dura. And then there's the fluid inside of that, in which the brain and spinal cord are floating in. And there's a whole dynamic that is required for us to be healthy among those different anatomical parts. And one of the big problems that we have when we have injuries is that the connective tissue that surrounds the brain and spinal cord and or the bones that those connective tissues are joined to have jams or locks or torques or distortions that then create neurological problems.
Because the information can't flow freely.
That's right. And as an educational kinesiologist, you know how important that is.
Yes, absolutely. The body-mind connection.
Yeah.
Yes. Yes. So if there's an injury or a trauma, or somehow it becomes compromised.
That's right.
And so that dialogue, that communication in that complex system can't happen.
That's right. And most of the compromise is connective tissue. So when we have an injury, we have an inflammation, and then its healing involves having connective tissue layers that are kind of disorganized, a scar tissue, essentially. And so the purpose of doing craniosacral therapy is to help scar tissue at that meningeal layer, meaning that connective tissue that surrounds the brain and spinal cord, to unwind. And there are a variety of different techniques, and one of the interesting things about craniosacral therapy is it's extremely gentle. It's not at all invasive like, I mean, I don't want to say that chiropractic is invasive, but a lot of people feel shocked when they have an adjustment. And,
or at least by the sound of it anyway.
Yeah, exactly. It's, sometimes it's an unexpected experience, and some people don't understand it. I feel it's very safe. In the hands of a skilled practitioner, a chiropractic adjustment is, I believe, completely safe. Certainly much safer than a lot of other kinds of medical interventions.
But I like the comparison of what you're saying, because if someone was to come for a session, they would, if they were familiar with another kind of body work, such as chiropractor or whatnot, they might think, are you actually doing anything, Mark, at first?
Right,
at first. And then, from my experience with you, as the session progresses, the unwinding and the opening becomes very obvious.
Yes.